Wright Podcast. This is the 26th episode of the show. Last week, I gave you a pretty big update from myself. I gave the message that I had officially stepped away from my first startup, and that was a big step for me personally. But now I feel clear-headed and confident to share my ventures in real time. That's something that I'm going to definitely be changing about anything that I do as an entrepreneur moving forward or as a business person, is sharing these updates real time, raw with the audience, with you. I received a lot of messages and support. I want to say thank you. I hear you. I see them. I've read them, and it meant a lot and encouraged me to keep going with this path. Today, what I want to focus on is frame the problem that I am solving as an entrepreneur. Last week, the basis of this episode was last week I had a conversation with this serial entrepreneur, very seasoned, been through many startups, many different businesses, and we were having a conversation about what I was working on. And he kept pushing me very much on what the problem I was addressing was or is. And I was a little bit nervous during the conversation. And so I kept floundering or fumbling my answer. And pretty much I got ripped apart during the conversation. He was saying, well, you're not addressing the problem that you're solving. You're just talking about solutions or features rather than what is the reason that this is even a solution in the first place. And so it really got me thinking and reflecting on how I present and what I present. And so this episode is to tell you about the problem that I'm solving today. In the United States, healthcare is broken. We know this. Prices are exorbitant. Availability is limited. And on the human side, if you don't have insurance, you're pretty much SOL. According to the Journal of the American Medical Association, we spend $1 trillion every year on administrative overhead in healthcare systems. This is not paying doctors or nurses. This is paying somebody to manage scheduling, billing, insurance claims, paperwork, pushing records back and forth, managing people and paper. That is the $1 trillion expense. And these are all tasks or job roles that could have been automated 20 years ago. In the veterinary subsector, this is the same story. The veterinary space that I'm in and was just in as an operator, same exact thing. 50% of a clinic's operating costs go to administrative care. This is, again, people that are running the business, not actually performing the work. Like I said, I saw this firsthand as a veterinary operator startup founder. And in veterinary care, it's a cash-based business. This means we don't have the insurance bloat or the layer of middlemen in veterinary care. The client typically pays cash out of their pocket for the services they receive, which is good to an extent that you can kind of see raw price dynamics of supply and demand. But at the same time, you wonder, well, where is my dollar actually going, especially as a consumer, as we're seeing prices go up and up. So the core problem in a sentence is that healthcare is drowning in admin. We have a people shortage across human and veterinary care, and we are not solving it. We are just burying the people we do have with administrative busy work. A couple of stats to support this claim. According to, again, the Journal of American Medical Association, administrative costs in U.S. healthcare systems account for 25 to 35% of healthcare spending. This means that if you pay $1 to your primary care physician, 35 cents of it is going to just admin, not paying the doctor or paying for your drugs or supplies that are needed for your healthcare. Physician burnout rates have exceeded 50%, according to the American Medical Association, with administrative tasks being in the top 2 reasons why. These people that are getting into healthcare are wanting to provide healthcare. not do admin work. And so instead of allowing them to just do healthcare, they either get admin work tasks, or the business or healthcare system hires admin layers overhead to do the admin work so that the provider doesn't have to. In veterinary medicine, there is a big debate going on right now with shortage of providers. Right now, the estimate 30,000 to 40,000 shortage of veterinarians is projected by 2030, with over 100,000 vet techs or vet nurses short by 2030. There's this debate because people are going back and forth on whether there actually is a shortage or if the burnout is caused, again, by admin overload or busy work overload. And what would it look like if these providers were only focused on providing care? So the question becomes, if we have this admin that costs, let's just say a clean number, 30% of a healthcare system's overhead, what happens if we reduce that overhead by 90%? On paper, this would increase the availability, increase provider and patient time, the time you're actually spending with your care provider, decrease cost of healthcare. Why? Because now the business has a greater margin and can reduce costs overall on the care they provide. And finally, for the business, increase the business margin. Instead of operating at 5 to 15% margin, you can now operate at 15 to 30% margin for the healthcare business system. As a veterinary care startup founder, I saw these problems firsthand. I was the problem, in a sense. I was the administrative co-founder of this veterinary group, and having the MBA, Masters of Business Administration, exactly what we're talking about right now, I was in charge and in the role of managing the business operations. And one thing that I became very frustrated with was, especially as a small startup, I was managing so many of these tasks, of the admin tasks, that did not increase business production or increase business revenue. In a sense, I felt that my role was just a cost on the business, and it was. And that's what admin is in a healthcare system or any service-based business. So what I'm focused on is addressing this admin overhead in healthcare. And my question is, what happens if you don't have that overhead? What happens if you don't need the admin overhead? If you could replace 90% of it and you replace the tasks, what would that do for the business? What would that do for healthcare in general? What I'm talking about are framed right now as AI employees that are designed to do these admin tasks specifically, perfectly, in accordance with the business and healthcare needs or business system needs that are required. That's the future. That's the problem framed for you to describe what the problem is that I'm addressing, and excited to keep working. I'm not quite ready to share the exact prototypes yet, but it's coming soon. So thanks for tuning in and listening to the Jacob Wright Podcast. I'll see you next time.